Chiropractic care, miracle cure or risky gamble? Chronic pain, stiff joints and mobility issues are challenges that can derail the quality of life. For many, chiropractic care has emerged as a potential non-invasive remedy. But is this hands-on practice truly a miracle cure, or is it more of a risky gamble? In today's video, we dive deep into the world of chiropractic care, its popularity, promises, controversies, and the facts health enthusiasts deserve to know. Let's explore this complex, often polarizing subject with a spirit of curiosity, inviting you to form your own informed perspective. Chiropractic care revolves around the belief that proper alignment of the spine and musculoskeletal system allows the body to heal itself without the need for drugs or surgery. Chiropractors primarily use spinal adjustments, manual manipulations of joints, to correct misalignments, also known as subluxations, and improve overall function. But chiropractic is more than just spine cracking. It's a philosophy as much as a practice, emphasizing holistic, non-invasive approaches to health. Therapies can include stretching, soft tissue work, lifestyle advice, and even nutritional counseling, all aimed at enhancing the body's natural healing process. Sounds promising, doesn't it? But as with many health trends, not everything is as straightforward as it seems. It's no secret that chiropractic care has gained traction, particularly among those seeking relief from chronic pain. For conditions like lower back pain, migraines, and joint stiffness, it's marketed as a way to address the root cause of discomfort, rather than just masking symptoms with pills. For many, this is an appealing prospect. Drug-free, surgery-free treatment that focuses on the body's innate ability to heal. Personal testimonials abound. You've likely heard someone swear by their chiropractor, claiming significant pain relief or even lifestyle-changing benefits after just a few visits. But why has chiropractic care become so popular now? One reason is the rising frustration with conventional medicine. Painkillers pose their own risks, including addiction, while surgeries can be expensive, invasive, and carry extensive recovery times. Chiropractic care promises a gentler, faster alternative, and for some people it delivers on that promise. Or does it? Is this growing popularity rooted entirely in proven effectiveness, or is it the result of clever marketing and anecdotal success stories? Before going further, let's consider what types of conditions chiropractic care is commonly used to address. Chiropractors frequently treat back and neck pain, sciatica, migraines and tension headaches, joint pain including in the hips, knees or shoulders, musculoskeletal injuries often in athletes. Chiropractors also suggest that routine adjustments can improve overall bodily function. Some claim to treat non-physical issues like sleep disturbances, digestive problems, or even stress. But, as we'll explore, the question of which conditions chiropractic care can effectively treat and which claims stretch too far remains part of the controversy. For supporters, chiropractic care offers tangible benefits. Many patients find relief from chronic pain when nothing else seems to work. Studies suggest that spinal adjustments may be helpful for conditions like lower back pain, often outperforming traditional treatments like medications. Advocates praise its non-invasive nature. Imagine addressing years of joint discomfort without needing surgery or relying heavily on medications like opioids. Chiropractic care is also often viewed as cost-effective. Sessions are typically priced lower than medical treatments or physical therapy courses. Holistic health enthusiasts are especially drawn to its whole-body approach. By focusing on the spine and nervous system, chiropractors propose that a well-aligned body can function more effectively, promoting both physical and mental wellness. For some, this works. Success stories flood health forums and social media accounts, glowing reviews of reduced pain, improved mobility, and transformative improvements to well-being. But we have to ask, how much of this is grounded in evidence, and how much comes from the placebo effect? While chiropractic care has undeniable benefits for many, it also raises red flags. Skeptics often point to a lack of large-scale, high-quality scientific evidence supporting its effectiveness. Much of the existing research is narrow or limited, leaving open questions about its role in mainstream healthcare. Then there's the issue of risk. Spinal manipulations, particularly for the upper neck, have been associated with rare but serious complications, such as strokes and nerve damage. While these instances are uncommon, they've fueled heated debate over the practice's safety. Some critics raise concerns that chiropractic care is sometimes marketed as a cure-all. Claims that adjustments can fix conditions like anxiety, asthma, or immune deficiencies lack robust scientific backing. This can give vulnerable patients false hope or lead to delayed evidence-based treatments in critical situations. Adding to the debate are voices from the mainstream medical community, many of whom view chiropractic with suspicion. A common critique is its lack of scientific rigor. Without more controlled studies, chiropractors' claims often rest on anecdotal evidence, powerful but not definitive proof. Another sticking point is the inconsistency in training and licensing across regions. Not all chiropractors undergo the same rigorous education, and practices can vary widely. This lack of uniform standards fuels skepticism, especially in medical fields where precision is paramount. Skeptics also argue that while chiropractic care may temporarily relieve pain, it doesn't address deeper structural or systemic issues. Could its benefits be short-lived, requiring patients to return indefinitely for repeated adjustments? Despite criticism, a growing number of health enthusiasts are embracing chiropractic adjustments as a preventative measure. These individuals seek care not because they're in pain, but to maintain optimal function and wellness. Chiropractors advocate routine adjustments to correct small issues before they snowball into major problems, claiming this promotes better health overall. But here lies another question. Are regular visits really necessary for prevention, or do they encourage dependency? Critics worry that the promise of maintaining alignment may lead some patients to seek unnecessary treatment or feel reliant on frequent adjustments to thrive. One of chiropractic care's most persuasive tools is the power of personal stories. It's impossible to disregard the uplifting narratives of people who've seen their pain relieved and their lives improved. But, as the skeptics remind us, personal testimony isn't proof. The placebo effect, a well-documented medical phenomenon, may play a significant role in these outcomes. If patients believe adjustments will work, their optimism and sense of control can sometimes drive real improvements, regardless of the treatment itself. That said, should we undermine the value of feeling better even if science can't fully explain it? Perhaps the legitimacy of chiropractic care lies somewhere between personal experience and evidence-based medicine. For patients considering chiropractic care, finding a qualified and reputable practitioner is key. Most chiropractors are licensed professionals, but regulations and standards vary significantly across countries. In some places, chiropractic training is on par with medical degrees, while in others, oversight is less stringent. Patients should feel empowered to research their chiropractor's credentials and inquire about their training. Regulatory improvements could help address safety concerns and strengthen public trust. An interesting development in recent years has been the slow integration of chiropractic care into some evidence-based medical practices. Joint care teams, including physical therapists and chiropractors, are now more common as a way to offer holistic, multimodal pain relief. This points to a shift. Rather than viewing chiropractic and traditional medicine as competing schools of thought, they may better serve patients when working together. Yet, advocates for evidence-based care insist that chiropractors must subject their methods to rigorous clinical testing to solidify their place in the medical field. While many benefit from chiropractic care, it isn't for everyone. Patients with certain conditions, osteoporosis, severe arthritis, or diseases affecting the spine, should proceed with caution. Additionally, individuals with a history of strokes or vascular disorders may be at heightened risk of complications during adjustments, particularly of the neck. Consultation with a qualified healthcare provider before seeking chiropractic treatment is crucial, particularly if pre-existing conditions might complicate care. Despite its challenges, research into chiropractic care is evolving. New studies are exploring its effects on chronic pain, its place in integrated care models, and its interactions with other therapies. While these studies are relatively new, they signify a promising step toward bridging the gap between anecdotal success and robust scientific credibility. Chiropractic care occupies a fascinating and controversial space in the wellness world. For some, it's a lifeline, a source of relief when traditional medicine fails. For others, It's an unproven and potentially risky practice. What's certain is that the divide between advocates and critics won't close anytime soon. In the end, your perspective may hinge on how much value you place on personal experience, scientific evidence, and risk tolerance. As health enthusiasts, it's our responsibility to stay curious, ask questions, and weigh the facts with an open mind. Whether you're a skeptic, believer, or somewhere in between, the conversation about chiropractic care reflects a larger discussion. How do we define healing? And where do we draw the line between hope and caution? Let's keep that conversation alive. What's your verdict? Miracle cure or risky gamble? Share your thoughts in the comments below.